So I'm Callie Williams. I'm a nurse practitioner. I've been at Birmingham Heart for about 2.5 years. Generally, patients love it because they know they're being monitored, and they know that we're looking at their information, and if something is wrong with that information that they may not realize, that they know we'll call them when we realize that something might be wrong, like their blood pressure is too high, or if they're on a blood thinner and they reported some bleeding events, and they really appreciate us looking at them closer.
We have seen several things that I think have made a big difference. Number one is I think it's improved our ability to care for our patients, in particular patients who were higher risk. We've been able to monitor their clinical condition more closely. In particular, I personally have been able to adjust their regimen, including their diuretics or other medications, a little bit more easily because I have more information to go from, and I'm hearing back from them about their response and their clinical condition.
I'm Donna Hardy. I'm the Chronic Care Management Coordinator for Birmingham Heart Clinic. We see a lot of congestive heart failure, cardiomyopathy patients, atrial fib, hypertension patients. Those all usually are very susceptible to chronic issues. So following them in my clinic, I can keep an eye on things that are important to their physician, more so than just blood pressure and heart rate, but symptoms. If they have any changes in symptoms, I know it immediately.
I have several patients that I've been able to make changes without seeing them back as frequently in clinic. One in particular, now I essentially just have Donna follow him. She's our medical assistant monitoring the program. So I follow his weights routinely just by using the program, and we'll contact him if I see things have been trending in a wrong direction and go ahead and make changes without him coming back or having to spend a lot of additional time. And this has been a big help for him, and honestly I think it's been a significant change that's allowed him to stay out of the hospital and to continue to feel well without having to come to the clinic so frequently or having to deal with the issue feeling like he's on an island by himself.
The reassurance, often patients get uneasy when they start feeling bad, particularly if they've been newly diagnosed. They go home from the hospital, some of them really don't know what to expect. So just someone there to kind of coach them through the hard times, the things that they are not used to experiencing, it eases their anxiety, and it also puts trust in us that we're taking their best interest at heart.
But that's allowed me to run my regular clinic, to do my routine responsibilities, and really allowed us to communicate with patients better, and it's prevented it from interrupting our daily workflow as patients come in and out through the day. One thing I've really been pleased with Chronic Care has been our retention rate. Initially, I was concerned that we would enroll patients, we would follow them during maybe a difficult time, and then they would not be as interested or fall off. And our retention rate has been phenomenal. And honestly, that's been the biggest surprise I've experienced with utilizing ChronicCareIQ is patients really like it. And as a result, they've continued to participate. And I now am seeing patients back that we've been following for over a year who haven't had many issues. I see them every 6 or 12 months, but they still are participating on a daily basis, if not weekly basis, with the program, and are very thankful for it and want to continue.